What's up, Sports Med? Hope you guys are doing well today. The other day we learned about terminology, and now, hey, don't be scared to use this terminology. With your parents or whoever, your siblings. I know I always talk about like, hey, are you using this terminology outside of the classroom? And everybody says no, but I mean, still might as well ask. Right, so just to review, we have the anatomical position from which all terms are described. Once again, like this is the distal aspect of the upper extremity, right? Because it's the furthest from. Now, if this person's hand were raised up in the air, that would still be distal because of the anatomical position. Dorsal, back, ventral, front. Got all that. Here, let's do something like this. Got an idea. So I'm gonna just, can I do this with this? Can't, because I typed it, huh? I'm gonna do this. Move out the way. Okay, real quick. All right, so let's say this X. Okay, where is it at on the forearm? You could say it's on the proximal anterior, and let's say I wanted it lateral, so we just have to move it over, right? Why doesn't it let me do that? There, okay, lateral aspect of, right, because it's on it. Okay, let's see, you guys remember what the top of the foot is called? Dorsal. And the bottom of the foot is called plantar. Good job. Man, so we really get to miss this fun game that we do. It's called the palpate game, where it's like Simon says, have you close your eyes and tell you to palpate, your anterior, posterior, whatever. And we usually play for extra credit or fruit snacks, but it's all good. All right, so now we're going to move on. All right, so now we learned terminology, and now we're going to learn the different body regions. So these are body regions. Okay. So when we talk about body regions, there's 11 different systems in the body, and I would say that all systems are in every body region. But I'd say it's in every region, but when it comes to what we're going to learn in here, we're going to focus mostly just on major organs and bones that are in the system. All right. So here we go. We're going to start with the head, which is the technical name, right, for the skull. So that consists of two parts. You have your cranial bones, and then you have your facial bones. Of course, your brain. Okay, so your skull is kind of one part consisting of cranial bones and facial bones. Moving inferior to that, we have this whole region of the trunk. Okay, so the trunk essentially goes from your neck. Here we go. Let me show you. So I think I could write on this, right? So it goes from the neck. Whoa, why did it do that? Don't want to say that. How do you erase it? Okay. All right, here we go. So your trunk is everything. Let me redo that. So your trunk is everything from your neck, ribs. So this is your trunk right there. That whole thing is your trunk. All right. And now we're going to learn the specific parts of it. So the trunk, we're going to start on the superior aspect and move our way inferiorly. So on the most superior aspect of the trunk, you have your cervical region. All right, so that is most superior. And remember, you can't use proximal or distal because it's you can only use that on the extremities. So that's the most superior region, consisting of your esophagus, trachea, larynx, and your cervical vertebrae. And just a little bit more terminology. So your esophagus, right, is deep, and your trachea and larynx is more superficial. And then we have cervical vertebrae. So you have 7 different cervical vertebrae.
Can the kids go in the front yard?
Yeah. 7 different cervical vertebrae. That's the total of cervical vertebrae that you have. And then, so yeah, esophagus, part of the digestive system. Esophagus takes food down to the stomach. Trachea and larynx. So your trachea is like your windpipe. And this is like extra info, right? Windpipe. Okay. So cervical region is the most superior region. Moving inferior to that. Oh, I got some pictures there. This is how it's supposed to look. What am I doing there? Yeah, that's right. And then next, you have your thoracic region. So now your thoracic region is just inferior to your cervical. So you have your ribs and sternum, thoracic vertebrae, and your lungs and your heart. Okay, so your ribs. So I'm sure you guys all like to eat ribs, right? Even though we're not eating ribs, we're eating the muscles that connect to the ribs. So how many pairs of ribs do we have? Does anybody know? 12 pairs. So you have 12 total pairs of ribs. And if you need something to help you remember that, is you have 12 thoracic vertebrae. So you have 12 pairs of ribs and then 12 thoracic vertebrae, and because each pair of ribs connect to a vertebrae. So let me show you on here. So if you look, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And they all attach to a vertebrae, right? So these are your thoracic vertebrae, 12 of them. And there's also 12 ribs, pairs of ribs that they each connect to a thoracic vertebrae. So that's one way. Do you guys remember what this section is called? Cervical. It's messing up. All right. And then your lungs and heart, obviously. And then moving inferior to your thoracic region, you have your abdominal region. And in your abdominal region, you have lumbar vertebrae and you have vital organs. So your lumbar vertebrae, you have 5. So and if you notice, this is the only region where the vertebrae are named something else, right? Like thoracic has thoracic vertebrae. Cervical has cervical vertebrae. But the abdominal has lumbar vertebrae, and you only have 5 of them. And then you have vital organs like your stomach. Well, actually, I'll do that in a second. So like, look, there's your stomach, there's your liver, small intestine, large intestine, spleen, so on. Okay. Oh. Okay. So cervical, thoracic, abdominal, pelvic, and then you have the region of your pelvic region, and then that consists of your sacrum and coccyx, which are part of vertebrae, or I should say, it's part of your spinal column. And then you have your reproductive organs and your bladder. All right, so one more time, let's just go through it. So you have your head consisting of your skull, cranial bones, and facial bones. Inferior to that, the next section, that big section that you have, is your trunk. So your cervical region is the most superior. Okay. and consisting of esophagus, trachea, larynx, and 7 cervical vertebrae. And then you have your thoracic region, ribs, sternum, thoracic vertebrae. You have 12 thoracic vertebrae, and you can remember that because 12 pairs of ribs, because they connect to each other. And then you have your abdominal region, which is inferior to that, with 5 lumbar vertebrae and your vital organs. And you have your pelvic girdle, which is sacrum, coccyx, and reproductive organs in your bladder. All right, so now let's take a look at this. So I know it's kind of a creepy picture, right? Like, look at the teeth. But anyways, so blue are the veins, the red are the arteries, green is like the lymphatic system. And then the yellow, is there any yellow in there? Usually the yellow is the nerves, okay, but you can't see it. All right, so to start off, right, so let's do this. So this is the head, right, or let's just call it the skull, because that's what we're doing. Okay, and then we have, so this whole thing, I guess we should do this for this whole thing. Okay, so this entire thing, so from here all the way down to there. So this whole thing, right, is your trunk. Okay, now let's go through the different parts of the trunk. So this first section is your cervical. Just inferior to your cervical region, you have this region here. Well, let me make that a little smaller. That is your thoracic region. These are all regions, right? And then you have, inferior to that, you have your abdominal region, which is all right here. Maybe even make that a little smaller. There we go. Abdominal. And then the last region, most inferior region, you have your pelvic region. Pelvic region. Okay, cervical, thoracic, abdominal, and pelvic. All right, so these are the regions. Okay, and so you have your skull, cranial bones, facial bones, cervical, esophagus. I'm not gonna really touch you too much what's in there, but it's just good to know. Thoracic, 12 thoracic vertebrae, abdominal, 5 lumbar vertebrae, vital organs. Let's look at some of these organs real quick. Or let me give you a little extra bit of information. So there's a spot right there. So there's an organ or a part of an organ that's right there. Does anybody know? On the right side, it's your appendix. And that spot right there is called McBurney. And look, I'm sorry, I know my handwriting is terrible. Oh my gosh. McBurney's point. And if somebody's tender or sore there, that could mean that an appendix problem could be a bad problem at McBurney's point. So just a little extra little bit of information for you. All right, so that's the part of the trunk. Okay, hope everybody's doing good there. Not bad. Let's go through it over here. Okay, so I don't know, maybe we could do it like this. Oh, that's the sacrum. Okay, so you have your skull, right? And then you have your cervical region. Then you have your thoracic region, abdominal region, pelvic region. Okay, so skull, cervical, thoracic, abdominal, and then pelvic. Okay. So this is, and then this is the trunk. The writing on this isn't too good. That's the trunk. Okay. So cervical vertebrae, right? There's 7, 2, 3, 4, 5, 6, 7. And just a note. So that bump right there, your C7, if you felt like the base of your neck, that spinous process right on the tip is the first spinous process you can feel. And then you have 12 thoracic vertebrae with 12 ribs, and then 5 lumbar vertebrae. 1, 2, 3, 4, 5. And then you have your sacrum and your coccyx, right, for your pelvic region. And there'd also be vital organs in there. All right. How we doing there? Are we doing good? I think we're gonna. Now let's keep going. Let's just keep going. Okay. All right. So now we're gonna go to the parts of the upper extremity, the different regions. Regions. I need to put that on here. Regions of the upper extremity. All right. So your first region of the upper extremity is your shoulder girdle. So that's where your upper extremity starts. Okay. It's most proximal. Okay. Consisting of your clavicle and scapula. So your clavicle is anterior. Your scapula is posterior. So that makes up your shoulder girdle. Inferior to that, you have the region of your brachium, right? Which is your upper arm. And the bone that is in there is your humerus. So you have your shoulder girdle, brachium, shoulder girdle consisting of clavicle, scapula, brachium consisting of your humerus, and then you have your antebrachium, which is your forearm consisting of your radius and your ulna. So your radius is medial, and your ulna is medial, and your radius is lateral. All right, and then you have your manus, which is your hand, consisting of carpals, metacarpals, and your digits, which are so you have 8 carpals, 5 metacarpals, and then your digits, which are made up of your phalanges. I know a lot of people have heard of that. And you have 14 in one hand. Okay. So your shoulder girdle, or your upper extremity, okay? So you have, get out of the way. Oh my goodness. Oh wow. Sorry. Stop it. Don't worry, we're just struggling a little bit. Not terrible though. All right, so you have on the upper extremity, so your clavicle and scapula make up your shoulder girdle. This is the region of your brachium. And then this is antebrachium. And then your manus. Okay, so these are regions, okay? So your shoulder girdle, brachium, antebrachium, then your manus. So your shoulder girdle consists of your clavicle, scapula. Your brachium consists of your humerus. Your antebrachium consists of your radius and your ulna. And then your manus with carpals, metacarpals, and phalanges. And we'll be able to show that better on this next slide here. Oh. Okay, so let me go through. So I'm going to do the same thing basically that I just did there. All right, so your clavicle and scapula make up your shoulder girdle. your, all right, here is the region of your brachium. And then this is the region, why I keep going back to that color? This is the region of your antebrachium. And then we have your manus, which is hand, okay? Shoulder girdle, brachium, antebrachium, manus. Shoulder girdle is clavicle and scapula. Brachium is humerus. Antebrachium is ulna and radius. Well, let's just write this down. Clavicle. Brachium is humerus. Antebrachium is ulna and radius. And then I have so here's your manus. Okay, so this whole thing is your manus, right? Okay, and then we have different groups of bones. So this first group of bones here are your carpals. This next group of bones here are your metacarpals. And then the last group are your phalanges. And you have 14 phalanges because you have 1, 2, 3 in each finger, but only 1, 2 in the thumb. So carpals, you have 8. Metacarpals, you have 5. And then phalanges, you have 14. And that's the manus. All right, so that's the region of the manus. You can see some more pictures there, more pictures there. Okay, so now we're going to move to the lower extremity. All right, the lower extremity, the most proximal region is your pelvic girdle. So again, regions. So the most proximal is your pelvic girdle, and that's actually made up of 3 bones that you don't need to necessarily know. And this is most proximal region. And then you have your upper leg, which sadly enough doesn't have a specific name to it. And then you have your patella, which is kind of, well, it's your kneecap. It's a special type of bone called a sesamoid bone. It's like a floating bone, all right? And then you have your crus, which is your lower leg, consisting of your tibia and fibula. So your tibia is medial and your fibula is lateral. All right. So lower extremity, so you have your pelvic girdle, and then you have your upper leg, and then your patella, and then your crus, which is made up of your tibia and fibula. And then you have your foot, and your foot is called your pes. So your upper and lower extremities are set up the exact same, same as with your hand and your foot, your manus and your pes. So your manus, you have carpals, metacarpals, and phalanges, and then your pes, you have tarsals, metatarsals, and phalanges. So we have 7, 5, and then phalanges, 14. And let's see, I hope I have a great I do. Okay, so you have pelvic region. Now look, don't get confused with the pelvic, this is pelvic girdle. Don't get pelvic girdle confused with pelvic region, okay? So your pelvic girdle is literally just this bone, okay? Right there. So it's just this bone right there. And now look, just to clarify, your pelvic region is like right there. Okay. So pelvic girdle is just that bone, pelvic region's right there. And then you have the upper leg. Consisting of your femur. Did I not put that up there? Yeah, it's up there. And then you have your patella. And then the region of your lower leg, which is your crus, tibia, and then fibula. And then you have your pes. All right. So there's the lower extremity, the regions of your lower extremity. Most proximal is your pelvic girdle. Then you have your upper leg. Then you have your patella. Then you have your crus, consisting of your tibia and fibula. And then you have your pes. Now let's talk about the pes a little bit more specifically. So here's the pes. Okay. So let's go through this here. So there's like I said, it's set up just the same as the hand. So these group of bones right here, these are your tarsals, and you have 7. And then you have these bones right here, and those are called your metatarsals. And then you have 5 of those. And then, just like in the hand, you have your phalanges. And you have 14. Okay, 14. So those are all the different regions, right? So I know we flew through that real quick, but that's why we have it on video. You go through it, watch it a couple times, take notes, pictures, whatever you want to do, and then we'll have plenty of time to review. Okay. So you have your pes. Well, let's just start at the top. So parts of the body, so different regions. Okay. So you have your pelvic girdle, which is the most proximal region on the lower extremity. Your upper leg is your femur. Your patella is your kneecap. Crus is the region of the lower leg, and then your pes, pelvic girdle, and then you have your upper leg. There we are. Upper leg, crus, tibia, fibula, and then your pes, consisting of your tarsals, metatarsals, and phalanges. All right. So that's going to be all the information for Friday, and that's part of the unit right there. So we have the terminology, and we have body regions, and we have a lot of time to review now. So that's what we got. Let me know if you need anything else. Email me anytime. Drop in on a Zoom for office hours. Whatever you want to do. All right. We'll talk to you guys soon.